Good morning, Mrs. Masta. My name is Jan Smith and I'm from the Federal Police. Why was I brought to this office? What's my mistake? You are brought to this office to answer some question regarding the money found in your handbag. You have in your possession 4,000 Australian dollars, 2,000 US dollars, 1,300 francs, and 1,000 Singapore dollars. Yes, I know, but why? What's wrong with it? You should declare having that money for custom purpose. Well, my friend told me that only prohibited items should be reported to custom. I didn't bring anything. I only brought clothes and books for my children. Now I want to go to meet them. Please don't worry, they have been asked to come in here. They are on their way. In the meantime, there are some questions that you have to answer first before we can release you. Do you understand? Yeah, I understand. Okay, right. Now, first of all, why didn't you declare the money when you filled in the form before disembarking? You didn't tick yes to the question of whether you have more than 3,000 Australian dollars upon arrival in Australia. I didn't know that I had to report the money. But it's in the form. I don't really understand, so I filled in no all. Is this your first time visit to Australia? When did you first enter Australia? This is my third visit. Two of my children study here, so I came here to see them. The money I brought was to increase their tuition fee. Right, third visit. So you should know by now that you're not allowed to bring that much money into Australia without declaring it. If you're not sure about your answering in the form, there are flight attendants on board the plane that you can ask them. But it's my own money. What's wrong with it? Where should I report it? We know it's your own money, but you know that you declared it before entering Australia for custom purpose. However, you didn't do this. It's a criminal offense, and we have to bring you to the police station for officially pressing charges against you. I'm afraid. Can I ask a lawyer for help? But I don't have money to pay because the money I was brought was to pay for my son's college. Yes, you can have a legal advice and it's free. We will give you a list and your daughter can help you to contact them. Good morning, Mrs. Gunawan. I'm Dr. Chang. I'm the one who will do the operation on your husband's heart. Thank you, doctor. Will his heart get better? His condition is stable and his spirit is high, so don't worry, I'll do the best I can. If I may ask, what will be operated on? Will you remove his heart for surgery? As I told you and your husband before, it's the blood capillaries which are blocked. Blood clottings were found in these capillaries. This was what caused the main attack 2 months ago. Unless we do something, another attack will follow and another. So you take the heart vessel. So replace with what? With artificial vessel. Are these artificial vessels safe? How long will it last? Yes, we will have to remove them. And no, we will not use artificial capillaries instead. So what's the replacement? Do you have to use the machine completely? No. His own heart will be replaced with new capillaries which will be taken from capillaries in calves. That's why we will perform 2 operations. Firstly, we will perform an operation on his calves and take the new capillaries from there. Secondly, we will perform another operation, this time on his heart, remove the damaged capillaries and put in the ones from his calves. Won't it bother his feet later? Would he be paralyzed if the vein was taken from there? That's not the case. He'll still be able to walk as normal. Will the blood be pumped out? Will it be thrown away? Will he get new blood? Then I have to find a new blood donor that is cleaned from the HIV virus. We will pump his blood out of the heart, that's true, but we won't need new blood. His own blood will be replaced after the transplant. Alright, thank you, doctor. Good, please don't worry. Good morning, Mrs. Hermanto. How are you today? I'm so scared. This is my first time in the hospital. Will I have a surgery? There's nothing to be worried about. It's just a minor operation. I don't want surgery, let alone obstetric surgery, because I still want to have a children. If I have a surgery, I won't be able to have children. As I said, it's only a minor operation. Anyway, I don't want surgery because I've only been married a few weeks. If I can't have a children, I'm worried that my husband will divorce me and find another wife. But of course you will be able to have a children. If so, why do you have a surgery? Why is it not treated or just injected? But your ultrasound test indicate that there is a cyst on your right ovary. I see. What does that have to do with my illness? That's what's caused the acute pain. Will I have surgery right away now? Not right away because of your history of dysmenorrhea. We have to make a laparoscopic examination. What does a lab test mean? What was that and what for? It's an examination in the lab using laboratory equipment such as the microscope to confirm the presence of the cyst and to exclude it out of the pathology. Will my stomach and won't be open wide? No, it's just a minor procedure, a small incision, nothing to worry about. Well, thank you doctor, now I'm a bit relieved. How long shall I stay in the hospital? My husband is home alone and he can't cook. Maybe a few days. Well, why do you have to worry about your husband? He is a big boy. He's the one who should worry about you, not the opposite.